Olá, galerinha, boa tarde. Sejam muito bem-vindos a mais um Mock Class da EFIG, do programa do My Way. Hoje temos uma convidada ilustre, que é a professora Cristina Comier. Hoje ela vai estar falando aí de carreiras da área da saúde. Espero que vocês todos divirtam-se, que vocês aproveitem o máximo. Alguns recadinhos antes. Pessoal que não me conhece, meu nome é Diego Porta. Acho que todo mundo já me conhece, mas para quem não me conhece, meu nome é Diego Porta. Sou Academic Advisor da EFIG. A EFIG, galera, é uma agência de educação internacional. Ela não é uma agência de intercâmbio. Então, se você tem aí a proposta de fazer uma universidade fora do país, se você tem aí o sonho de fazer um semestre, 6 meses num high school, ou mesmo um summer camp, nas férias de julho, que é o verão deles, o nosso inverno, pode nos procurar. Nosso time vai ajudar você a encontrar aí o melhor fit para você, o melhor match para a sua vida, tá bom? No programa das universidades, nós temos o programa de aconselhamento, que é um programa que tem muitos profissionais envolvidos, que, por exemplo, acho que muitos de vocês já sabem, para aplicar para uma universidade internacional não existe o vestibular, o que é muito bacana, o que é muito bom, não tem aquela estresse no final do ano. Mas existem diversas outras coisas que vocês têm que fazer, tá? Então vocês vão ter aí aula com uma professora americana de como escrever um personal statement, um treinamento de como se portar e como fazer a prova do IELTS ou do TOEFL, que é a prova de proficiência do inglês. Para quem for para os Estados Unidos, um curso preparatório para o SAT. Vamos ter ali, vocês vão ter o contato direto com as admissions das universidades. Então, por exemplo, vocês querem fazer medicina na Irlanda, medicina nos Estados Unidos, alguma coisa. A gente vai colocar vocês em contato com os admissions, numa reunião, vocês e o admission dessa universidade. Então, é um programa muito bacana. E aí, no decorrer do programa, você vai aplicando, nós, junto com vocês, vamos aplicando para essas universidades e depois vocês recebem aquelas cartas de aceite, igual de filme, que você chega no correio, a cartinha aqui, parabéns, você foi aprovado nessa universidade. É muito bacana. Então, se você tem interesse em fazer o programa de aconselhamento, pode entrar em contato. Eu vou deixar meu telefone e meu e-mail no final. Também, high school, quem tem interesse em fazer high school no Canadá, nos Estados Unidos, e o summer camp, tá bom? Bom, vamos lá, eu acho que já temos aí um número legal. Vamos lá. Galera, nos últimos mock classes, vocês não estão abrindo o microfone para interagir com o professor, tá? Então, a professora Cristina, ela é sensacional, ela é muito bacana, então abram o microfone, conversem com ela, tirem suas dúvidas, compartilhem suas experiências nessa área da saúde, o que vocês gostam, que vai ser muito bacana. Se vocês não estão confidentes com o inglês de vocês, porque eu conheço o nome de alguns aqui, não tem problema. Põe no chat, eu leio para a professora Cristina e aí ela responde diretamente para vocês. Mas, gente, português é minha primeira língua e, assim, 99% do grupo aqui que está aqui, tirando a professora Cristina, fala inglês é a segunda língua. Então, assim, não tenham vergonha, tá? Arrisquem. Essa é uma grande oportunidade que vocês têm. Tá bom? A professora Cristina hoje vai falar de 45 carreiras da área da saúde em 45 minutos. Espero que vocês se divirtam. E é isso aí. Amanhã, provavelmente, o certificado já vai estar pronto para vocês. É só acessar o site do Simpla e fazer o download, tá bom? Thank you very much, Teacher Cristina. Thank you for joining us today.
Thank you, Diego. I'm glad to be here today. Diego, I'm going to share my screen now, okay?
Yeah, okay.
All right, everyone. So thank you so much for listening in today. My name is Christina Cormier, and I've worked at the Massachusetts College of Pharmacy and Health Sciences University in the International Admissions Department now for about 4 years. Diego, is this a good volume? Can you hear me? Diego?
Sorry, perfect. It's perfect.
Okay, great. So I just want to make sure everyone can also see my slides here. Diego, is the slide working?
Yeah.
Excellent. So thank you all again for joining me today. Today, I wanted to talk with high school students, high school counselors about what we offer here at the Massachusetts College of Pharmacy and Health Sciences. The university is located in Boston, Massachusetts, which is a very popular destination for international students. MCPHS is the acronym of the school, and as you may guess, many students study pharmacy here, but we offer over 100 different careers in the health sciences. So today, wanted to discuss with you sort of what those pathways are, what the academic system looks like at the university level in the United States, and how long you would be in school to become a healthcare provider at a variety of health careers in the US. So to get started, this is a bit interactive. If you have a piece of paper or your iPhone nearby, if you wanted to number 1 through 10 and letter A through J, so 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and A, B, C, D, E, F, G, H, I, J, go through with you. In the next 40 minutes or so, cover about 45 careers that are popular in healthcare here in the US. So my hope is that you'll learn about a new career, and you'll also learn about what your journey might be as a student in the pathway from high school through university to your first day on the job as Dr. Porta, for example, right? So we'll walk you through sort of what that looks like. So again, Diego, thank you so much for having me. My role at the university, I am not a full professor of any particular department. However, I do read all the applications from high school students in any of the Americas with international status. So if you are from any country in Central or South America in high school applying to the university at MCPHS, I will be the first person to read your application. So if you have any questions about the application process to university in the US, Diego and I work very closely together, and we're here to support you and help you on that journey as you look at options here in the States. Okay. So this is where all the work will be. As you can guess, most students come to me and ask about being an MD or a medical doctor. So this is, as some of you may be able to guess, what is the doctor of the brain, neurologist, the doctor of the heart, cardiologist, the doctor of the skin, dermatologist. These are all doctors who go to medical school. There are lots of people in healthcare that we refer to as Dr. So-and-so, right? Dr. Porta, Dr. Lopes, etc. But not all of them are medical doctors. And we're going to talk numbers 2 through 10 in the United States are typically healthcare providers that we refer to as a doctor, but are not medical doctors, but have that sort of prefix to their name. So medical doctors, and MCPHS has a very strong commitment to helping international students become medical doctors through an undergraduate program called pre-med. So pre-medical health studies is the name of the bachelor's degree, which is a 4-year program. After this 4-year program, students do an additional 4 years at a partner medical school in order to complete their bachelor's of science and their medical doctorate degree. This allows the students to sit for their licensure and attain potentially their residency in the United States. Those residencies are very important, and going back to where we started, whether you're a doctor of the brain, the heart, or the skin, or hundreds of other options, really, those would all be residencies that you would do as a medical doctor. So there are lots of different types of medical doctor that you can be, typically a minimum of 8 years. We do have an accelerated program for some students, and I'm going to just skip ahead here. So there are students who do this in 7 years. through a 3+4 program. Students who do this in a 4+4, so their bachelor's takes 4 years. We have some students who will do it in 3 years, but their 4th year is very interesting in the way that they go to our partner medical school, and their 1st year of medical school courses actually count towards both the bachelor's degree and the medical doctorate degree. So that's a really great way to really capitalize on some time, maximize your university tuition dollars that you're spending, and also get the academic content that you need to be successful. This pathway does not require the MCAT, which many of you may already know is the entry test that you need to take to get from university bachelor's programs to the medical doctorate programs in the United States. So this program reserves the space for students in the bachelor's degree for the doctorate degree, and you get all of that assurance right from the time that you're in high school, which is pretty amazing. We partner with St. George's University for this medical school agreement for a couple of reasons. One is that they accept international students. So you do not need to be a US passport holder or a dual citizen to be able to enter this program. It's very difficult to get accepted to United States medical schools. It is particularly difficult for a student without American citizenship. This means that international students are accepted at lower rates, particularly to United States medical programs than US residents are. St. George's, however, has a program that allows students to attain US residencies and do clinicals in the United States, in fact, while also getting their MD degree. It's accredited and recognized in all of the 50 states. And again, this accelerates the program from being either an 8-year academic journey down to a 7-year academic journey, and sort of springboards you into lots of these residency choices that we've already talked about. Okay, so enough about being a doctor. Number 2 is a doctor of osteopathic medicine. And so here in the United States, MDs typically treat in this allopathic format of medicine. Allopathic is A-L-L-O-P-A-T-H-I-C, for those of you who may want to Google this and are unfamiliar with that word. Allopathic is sort of this disease drug treatment plan that we have for things here in the United States. So what is the illness? How do we treat that illness? And we move on from there. Osteopathic doctors do things a bit differently. If you can think for a second, what are some things that you do every day to maintain your health? I'll let you think. Perhaps you've thought of how you sleep or how you eat or how you exercise. All of those are really great ways that we maintain our health each day. And an osteopathic doctor really uses those 3 things to focus inwardly on the body and may make recommendations along with the medication, but instead of saying, okay, well, if you're asthmatic, here's your inhaler, they may also say, here are some ways that we can increase your fitness. Here are some foods that may help with this ailment that you have that's causing your disease to progress. So they look at things a bit more holistically on the osteopathic side. Osteopathic doctors also have residencies like medical doctors. And so they may also go into specialties that we've already talked about. I'm sure you can recall the doctor of the brain, neurologist, doctor of the heart, cardiologist, doctor of the skin, dermatologist. And there are many, many others. Next, we'll move on to number 3, the doctor of optometry. And this is very popular. There's actually 26 optometry schools in the United States. Does anybody know who the doctor of the eyes is? The optometrist. So the ophthalmologist is a medical doctor who does eye surgery and a bit more invasive procedure. An optometrist can still do a diagnosis and have a lot of the same skill sets as the ophthalmologist does, but may see more patients, may own their own clinic, their day-to-day job is a bit different, and they don't go to medical school. They go specifically to one of these 26 optometry schools, and they may open up their own eye clinic to fit people for glasses, diagnose specific eye conditions. We have students who go into glaucoma research, students who go into pediatrics. Residency for optometry is optional. So we have students do 4 clinical rotations as part of our program. And then from there, there are some years where we have 6 or 7 students international students, in fact, that have maintained a residency here in the United States. And then there are other years where we have students seeking employment immediately after graduation as well. So there are lots of options for optometry. As many of you know, right behind your eyeballs is your brain, and there's a lot that we can see through the eyes about the brain. So some students say to me early on, perhaps they watched Dr. House or Grey's Anatomy or one of these shows online, and they say to me, I really want to be a neurologist, I want to be a brain surgeon. And I ask students sometimes, have you ever really thought about optometry? Have you ever thought about what you can tell, or health psychology? There are lots of other majors and other ways to work in healthcare where you make an impact that does not necessarily have to do with the brain, or being an actual doctor and doing brain surgery. There are lots of other ways that you can impact the brain through optometry or one of our other careers that we're talking about today. Number 4, and again, all these blue letters here on the left are the letters that would go after your name. So I'm Christina Cormier. If I was Christina Cormier an optometrist, I would be Dr. Christina Cormier, comma, OD would be the 2 letters at the end of my name based on my degree. Number 4 is a bit different, and hopefully you all made this person proud this morning by brushing your teeth. This is a doctor in dental medicine. So dentistry is traditionally more of an 8-year program here in the United States. There is another career in dentistry that we actually do see a good number of students go into from international backgrounds, and that's the dental hygienist. The dental hygienist or a dental assistant are either 2 or 3-year programs in many cases, where students can learn how to clean teeth, how to counsel patients on general dental care. There are dental hygienists and dentists that work with pediatric populations or adult populations, or specifically geriatric populations. There are people who will go on for residency in dentistry, although again, that is not necessarily a requirement post at your education. And so in that case, there are dentists who will go on for residencies in pediatrics or in surgery and have additional letters after their name other than the DMD that will certify them to do different types of careers. And then again, the other options are to do the dental assistant or the dental hygienist. The dental assistant is a little bit more limited than the dental hygienist in terms of the number of skills that they have. But there are lots of options for students to go into dentistry and a variety of different careers that you can choose within dentistry as well. One of the very unique programs that our university offers for dentistry is a way for you to do the dental hygienist program and the prerequisites for dental school at the same time. So we have a pre-dental dental hygiene program, which gives students the academic qualifications that they need for dental school, which are going to be courses like organic chemistry, biology, calculus, some really upper level sciences, and then also the technical skills of a dental hygienist. So knowing the numbers of the teeth, being able to pick up and use the instruments in the mouth. So this is a great practice, and we've seen a large number of our students in this pathway find success to dental school admissions in the United States because they've done a great job focusing on those very specific hard sciences and also getting experience in the field when they're very young, in their teens, right? 17, 18, 19 years old, just quite young to start practicing on people's teeth. And our university actually owns its own dental hygiene clinic. Students and patients come down to the clinic and they can get their teeth cleaned on campus for $5. We have elementary schools and nursing homes that come and are able to have their patients supported through our clinic. And we actually do that with our optometry program too. We have our own optical, our own eye and vision center. And so these are really great ways for students to get experience really early on in our careers. So number 5, I have to talk about, as someone from the Massachusetts College of Pharmacy and Health Sciences University, pharmacy, a long time ago was a certificate and then a bachelor's and then a master's, and now it's required that you have a doctorate degree in the United States to practice as a pharmacist. If you had one of those other degrees, you were sort of grandfathered in, but at this point there's no more education option for you to pursue a bachelor's or master's programs in in pharmacy in the US. So if you want to be able to dispense medication as a pharmacist, you need to go and attain a PharmD degree, a Doctor of Pharmacy degree. There are several programs in the United States that offer early acceptance from high school to students to go into what we call direct entry 0 to 6, which means a 6-year doctorate program for pharmacy. This is very attractive to high school students who are very strong in calculus and in chemistries and know that they want to be pharmacists. Otherwise, if you were to go to a traditional university pathway, you would do 4 years of a bachelor's degree plus 4 more years or potentially 3 more years of pharmacy. So in this pathway, there's about 12 schools that do this 0 to 6 direct entry program, MCPHS being the largest of those programs, where you are early accepted to your doctorate portion of the program, provided that you keep your grades up those first 2 years. Again, with pharmacy, I'm not sure how many of you on the other side of this screen are jumping up and down excited to do pharmacy. But it also has very interesting residency options for students. We have, again, students who go into pediatric pharmacy, students who go into veterinary pharmacy, students who go into medical compounding, students who go into industry research. I'm sure many of you can guess, based on the current global world health situation, there are lots of opportunities for vaccine research right now. And we have lots of students who have a background in pharmacy who are interested in working for some of these large companies and going into other avenues of the pharmacy industry. So dispensing pharmaceuticals at a traditional pharmacy is one option. And we have students who may meet with patients at a CVS or a Walgreens or a Stop and Shop or Walmart or a traditional pharmacy here in the US and give individual counseling to patients who are on a multitude of medications and maybe need to condense that or change how they're impacting them health-wise. And that's maybe about 60 to 70% of what pharmacy is in the US. However, there's a large number of clinical pharmacists. So there are ICU specialists, cancer specialists that work specifically on medications in those areas. And then again, that industry piece where you may work for a large company like Pfizer or Merck, which are these really large pharmaceutical industries that do a variety of work. And we'll talk a little bit about that in a minute as well. Number 6 on my sheet here is the Doctor of Podiatric Medicine. Anyone know what a podiatrist does? If you're over there saying they work on your feet, you are correct. So podiatrists typically can prescribe medication, actually. They can do simple surgical procedures on the feet, but that's primarily what they do. They work a lot with athletes, actually. So a lot of sports teams have podiatrists and physical therapists, and we'll talk about those in a minute as well. And so if you have an interest in working in sports medicine, podiatry and feet don't bother you, perhaps podiatry is something you should look into. Podiatry is a little bit different. Some of the graduate programs go to school through the summer and some of them do not. And so here in the US, the amount of time can vary. I would say between 7 and 9 years would be an applicable amount of time between getting starting your bachelor's degree, your first year of university, all the way through getting your doctorate degree in podiatry. Number 7, also for number 6, podiatrists also typically work with geriatric patients, so the elderly. So if you're interested potentially in working in elder care, if you think about maintaining stability, or you think about some of the people in your own life as they have knee pain or ankle pain, they work a lot with patients in this area as well. Number 7 is the doctorate in physical therapy. So another career in physical therapy would be the physical therapy assistants. This is a 2-year program, and people who are doing more of the assisting, maybe warming a patient up or helping a patient stretch, but they're not necessarily doing the full development of a treatment plan or the rehab for a patient, the way that a physical therapist sort of designs the metrics for how a patient has been impacted and what their future goals might be in regards to their mobility. So physical therapy, and again, a large number of students interested in sports medicine as an undergraduate level may be interested in this later. We offer a 6-year direct pathway for students as well to do a 3+3 bachelor's and doctorate in physical therapy with MCPHS. And again, they work a lot on gross motor function. So if you think about what your big functions were today, perhaps you climbed a flight of stairs, or went from laying down to sitting up in your bed, or went for a walk. Those are some of your big motor functions that you did today, and those are really the big muscle groups that a lot of PTs may focus on. Physical therapists also go into a variety of different specialties. So there are pediatric physical therapists, there are women's health physical therapists, there are physical therapists that specialize in working with individuals that have been impacted in brain injury. Again, so if you are interested in neurology or working with the brain, perhaps doing rehab and developing a long-time relationship with your patients is something you're interested in, that might be also something to consider. I think sometimes when we think about healthcare careers, we just pull a career out of the sky. We say, oh, my uncle's a nurse or my aunt's a pharmacist, I'm going to take on this career. But I think it's important to think about who you are, what type of care you want to give to your patients. Do you want a long-term relationship where you see them every month for 7 or 8 or 20 years? Or do you want a relationship where you help them in perhaps their most emergent critical time? Or do you want to work with them in smaller chunks, maybe 3 to 6 months through their rehab, and then hopefully get them to a new place? Those are some of the other things to think about, other than what you'll do, but maybe who you want to be. How long do you want to work with your patients? What type of care can you see yourself giving? A physical therapist and a podiatrist are going to be able to touch patients, manipulate them in many cases, may need to, where pharmacists might be able to do a lot of their counseling based on conversation, and they maybe are not touching patients as much. So that may be something that you want to consider too. You may know yourself and know what you want to be able to do. Number 8 is a doctor of chiropractic medicine, and they work in the joints. So a lot of times students here in the US say they crack your back, but I think any chiropractor I've ever met has sort of cringed when they hear that, because they work with the joints and realigning, really working in a holistic approach of medicine. So if that word rings a bell, it's because we talked about holistic medicine on number 2 with the doctor of osteopathic medicine. Number 9 is the Doctor of Veterinarian Medicine. Again, like our SGU pathway with the MD, MCPHS also offers a DVM, BS DVM pathway for students who want to go into veterinarian medicine. As you are probably all aware, veterinarians work with the animals in our lives, both small and large. And the last career I want to talk about here is the Master of Physician Assistant Studies. So the MPAS degree is someone here in the United States who can administer a diagnosis and be able to prescribe medication to a patient and works underneath the supervision in some cases of a physician, but may not necessarily have a physician in the building, in fact, even when they're practicing. So they sort of work in conjunction with a doctor as an extension of them, and they'll always have the physician support. But they do work independently quite often and also have a variety of specialties. The PAs go into a lot of those same residents we talked about in coming full circle with number one. If I can quiz you again, the doctor of the brain, the neurologist, the doctor of the heart, the cardiologist, the doctor of the skin, the dermatologist, and again, dozens and dozens of other specialties in the Master's in Physician Assistant Studies as well. The PA degree, though, is very interesting in the way that you can start working after 6 years, where an MD typically isn't working independently until it's been about 9 or 10 years, right? It takes quite a long time to do their bachelor's degree, medical school, residency, and then be able to practice independently, where the PA does their bachelor's degree and master's degree, and then really is allowed to practice in any of those core disciplines that they've learned, emergency medicine, dermatology, etc., that if they've done them during the duration of their master's degree program. So we see a lot of students who want to work in healthcare, who want the accessibility of an MD potentially, but they don't want to go to school for quite that long. They also like the scope of care that a physician assistant's able to provide. And I think another career that's not listed here that I want to mention is the nurse practitioner. So if you are interested in going into all of these fields, but maybe none of them quite fit, you find yourself caring, compassionate, you read a lot of college essays about students who find that they're very maternal to friends, to younger siblings, to cousins, any of that. Perhaps nursing is a career for you. And a registered nurse has a large scope of care here in the United States, and the nurse practitioner actually has some of the same scopes or some of the same abilities that the physician assistant has in the way that they can both diagnose and prescribe medicine. So if those are two career goals for you, there are lots of other careers other than being a doctor, a medical doctor, that can give you those functions in your career. So those are things to think about. All right, Diego, I'm going to take maybe a couple of questions just on this first half. Can we go to some questions?
Yeah. Has anyone got any questions? For example, when you say the physical therapy, this kind of career, they also can work in a sport, for sports, right?
Yeah, that's absolutely correct. So here in Massachusetts, right, there are physical therapists who work on baseball teams. There are physical therapists who work at high schools. There are physical therapists who work in outpatient clinics. There are physical therapists who work in hospitals. I think sometimes when students consider a career, they think, I'm going to school for this one career. This is all I'm ever going to be able to do, without realizing that your one career may have a variety of different options.
Yeah, true. Any question, guys? Please, you can open your microphone and talk to Teacher Cristina. Ou senão vocês podem digitar no chat que eu leio para vocês. Não precisa nem ser pergunta, mas se vocês quiserem dividir alguma informação, compartilhar alguma ideia, vamos aproveitar.
I have no doubts at this first part.
Okay, Mariana, go ahead. Mariana?
No, I said that I had no doubts.
Oh, okay, sorry. Okay, good.
All right.
Okay.
Well, if everyone is still excited to keep learning, I'll keep going.
Okay.
And maybe you guys can think of some questions during the second half here. That's sort of my intermission. I don't want to just talk at you this whole time. I want this to be engaging. So if there are careers that are new to you, I'm interested to know which ones you've never heard of. If there are some that you know you're very interested in, like being a doctor, and you want to talk a little bit about what your aspirations are in that regard, share those as well. I'm interested to know from those of you here. Diego, is there a comment section?
Yes, is that Rodrigo Martins? And then he said he doesn't have any questions at the moment.
Okay. All right. So if everyone could maybe in the comment section just type what their career goal is. If you had to pick a job in healthcare, what would that be? Would you want to be a nurse or a doctor or maybe one of these other careers I've mentioned? And we'll talk about some of those careers that come up in the comment section at the end. But for the next 10 minutes or so, I'm going to go through the lettered list here on the right. So,
sorry, teacher. I'm just going to say, if you are too, I don't know, if you don't want to bother teacher Christina, you can just raise your hand, and then I will be the annoying one to bother teacher Christina. So raise your hand, and then I say, teacher Christina, someone wants to talk, and then you guys can talk. So teacher Christina, as you can see, she's very nice. So yeah, so she's not gonna be angry if someone interrupts you. That's the idea. We should interrupt her because we have to exchange our idea and our knowledge, right?
Absolutely, Diego. That's a great point. There are no bad questions, only opportunities for us to engage and answer some questions and get new knowledge taught to students. That's Diego and I's goal throughout this experience. So even after today, if you ever think of a question about one of these jobs or how to apply to be a student that learns how to do one of these jobs, please reach out to Diego and myself, and we look forward to working with you. So I'm going to go through these last half of our careers here, hopefully covering about 20 or so more. Number one is a bachelor's degree in biomedical informatics. And this is really an intersection of students who are really interested. If you know what a mitochondria are and C++ JavaScript, then this might be the language for you. Informatics is the hybrid of technology and science. So if you really love computer science, but you also really love working with people, then maybe biomedical informatics is for you. So when we think about getting all of our electronic healthcare records online, when we think about dispersing a vaccine across the world, all of this has to get done through computers. And our best physicians are not our best computer programmers, and our best computer programmers don't necessarily really understand the needs of the healthcare community. And that sort of interaction is where this career comes into play. People who are really great at computers and really great in healthcare that can see maybe why a doctor needs a computer to work in this specific way. And the computer person would only understand, well, that's not the most efficient way. It would need to do these things instead. This is the person who can sort of see both sides of that. So they're really creative thinkers. If that sounds like you, maybe this is something that you're interested in as well. Radiation therapy is a lot like nursing, but a little bit less icky is the word I would use. So if you're thinking that you want to be a nurse and maybe you have a cat and your cat gets sick, or you hate cleaning the litter box because it's really stinky, radiation therapy, it might be a better fit for you than nursing. Nurses see and smell and touch a lot during their careers, and they are really heroes in our healthcare community. We couldn't couldn't have a functioning hospital or a medical office without them. They're incredibly necessary with incredibly big hearts, and we need our nurses. But there is a certain stomach that you need to have to be a nurse. It can be quite tough. Personally, you're up on your feet for very long hours. And again, I think the exposure that you have to some things as a nurse is quite large, and you need to be prepared for those things. And if that excites you, nursing is definitely for you. And if you're thinking to yourself, wow, I never thought of what I might have to see and touch, and I don't want to do that, maybe radiation therapy is for you. So radiation therapists work specifically in a pseudo-nursing role, so a little bit like nurses in the way that they're there for their patients from the time of their cancer diagnosis all the way through hopefully a remission or through a transition to other types of care where they might need in-home care, where they might need end-of-life care. And so this is very important work that is being done on a radiation therapy level, but is again really specific to working with cancer patients and maybe is a little bit less invasive in terms of interacting on the actual patient, but very supportive role for them throughout their cancer diagnosis. Letter 3, is diagnostic medical sonography. And if I'm being honest, I did not know what this was before I started this job at MCPHS. Sonography is ultrasound. So if you think about ultrasound, perhaps some of you are thinking of OBGYN and women's health and babies and being able to see a baby during pregnancy. And that's actually only one of 8 different ultrasound specialties that we have at MCPHS. We have students who go into musculoskeletal, again, going back to sports medicine, students who do ultrasound specifically on muscles and being able to see certain tears and doing therapies through ultrasound specifically as they relate to in sports. We have students who go into echo ultrasounds, which are ultrasounds of the heart, and being able to work with both pediatric and adult patients in that capacity. We have students who go into vascular ultrasound. So there are lots of choices when it comes to a career in ultrasound. And those patients are typically in front of their clinician for about 45, sometimes minutes, an hour. And they may see them on a variety of times, but it's certainly a challenging procedure, sometimes a nerve-wracking procedure to have done. And so it's very comforting to have a kind person that's sort of there doing those procedures on the other side. So that might be another career you want to investigate. Letter D typically is not very popular, but I would say very popular these days. When we think about public health, we think about what makes up a school's lunch program. We think about the laws that we have around safety seatbelts. We think about, but now we really think about vaccines. We think about COVID-19. We think about being able to get out communications about how to best protect ourselves from a virus, how to regulate our transportations, how to regulate our schools, and all of that is done under the guidance of public health. So within public health, unlike many of these other careers where you go to medical school and you become a doctor, when you get a bachelor's in public health, you're not necessarily a public health provider. You might be an educator, you might be a researcher, you might be working for a city or a town or a state or a government or a global company that is developing and educating patients on new drug therapies. So there are so many options within public health. So if you are not 100% sure what you want to do, public health is a great career to sort of get into things and think about where you want to make your impact. If you want to work in education, maybe public health can also be a great route for you as well. Letter E is histotechnology. these are types of scientists that work in laboratories particularly. So we have lots of students who say to me, I know I don't want to work on patients, but I want to work in healthcare. Histotechnologists or a clinical lab scientist may work in a laboratory setting, more specifically on looking at human tissue in the histotechnology case. These are also an element of students who want to go into forensic science and maybe investigate criminally. But again, there are students who have that training in both a provider piece and a research piece. So
Sorry,
forensic
Christina,
nurses.
like CSI?
I'm sorry, Diego?
Like CSI when they are
Like
working.
CSI, yeah, that's a great example. But however, in real life, it's very rarely just one person in the lab saying, I solved the crime. There's usually a really big team of people there that have different responsibilities. So one person's responsibility might be to look at the human tissue on a cellular level. And they might be able to tell you that that patient was, I don't know, diabetic. And then you might have another person in the lab who looks at maybe the external factors that impacted the crime scene, so the dirt or mulch or something like that. And so there's a large team of people that would do that. And I want to talk about the person who bridges those two things together, and that's the forensic nurse in many cases. So if a patient comes to the hospital, there are some nurses who are specifically trained in being able to collect evidence off of a patient's body. So whether they've been assaulted or their shoes, there's someone that's there that is specifically trained to sort of capture this evidence. And sometimes that's a forensic nurse, sometimes that's one of the clinicians, one of the laboratory assistants as well. So these are typically bachelor's or master's programs, and that's another career that we see a lot of students interested in as well. Letter F is nuclear medicine technology. I think this is one of the most interesting. In fact, some of our pharmacy students get certified in something called nuclear pharmacy, where they actually work with radioactive almost material and help portion that into a way that it is safe for the body. And then nuclear medicine is when they would intravenously, so through a vein, be able to start an IV, and it sort of provides these 3D scans of the body where we can watch the drug travel through one of our organ systems. Maybe that's the respiratory system where we breathe, or maybe it's our digestive system, but it's able to show physicians and radiologists. Radiologists are physicians, so medical doctors who actually are able to read different types of medical scans. So sometimes those are ultrasounds that the diagnostic medical sonographer takes. Sometimes those are nuclear medicine technologists that are taking these sort of 3D PET or CT scans, are what they may be called, that capture sort of the body in motion or in process so that we can see where potentially our organs or our system is failing us, or where there's disease presence, so that we can tell the radiologist can tell the doctor sort of what our next steps might be in a patient's care plan. And that's different than the last type of imaging I'm going to talk about today, which is radiography, which if you've ever fallen, unfortunately, and broken a bone, you may know too well are x-rays. And x-rays are still one of the easiest ways for us to identify breaks in bones. And so they traditionally are capturing these x-ray images. The other career I want to talk about, and this is where we're going to do a little deep dive onto pharmacy, because not all students want to work with patients and work in dispensing medication. Our first career that we'll talk about is pharmaceutical sciences. So pharmaceutical scientists are working potentially in our mass spectrometer, where you can basically drop an Advil into this machine on our campus and it will print you out a list of all of the periodic table elements that sort of make up that medication. And then they're rearranging that, trying to find something new. They're testing medications. They're really trying to work with things on a molecular and chemical level. When they think that they find something that might work, they hand things off to our pharmacology and toxicology students. These are people who are working more in drug testing. So if you think about right now, these Novartis, these big companies here that are trying to develop solutions to our current global health pandemic, that might be a pharmacologist or a toxicologist sort of looking at new ways to develop care. When those things go for the FDA approval or the approval for safe care or safe dispensing, and that is approved, that's when they go to our pharmacy students. Our pharmacists are able to start dispensing that medication. But there's a lot that is actually done on the back end of this, and I know this may be popular, are for students who go into healthcare business. And we actually have a bachelor's in healthcare business here as well, and also a bachelor's degree in pharmaceutical business, which is a way for students to get experience marketing and managing these new drugs. So when a new drug is approved, it has to, doctors have to learn about it. They have to learn about how the drug works, who the drug is meant for, what drug it's a better solution for than the current drug that's on the market. And so there are individuals who are trained, not as doctors, to go and educate doctors about these new drugs that come to market, and they have a large pharmaceutical background to them. The next career I'm going to talk about is occupational therapy. So they have a lot in common with physical therapists. Occupational therapy is typically a 5 or 6 year direct master's or master's level program. So students go for a bachelor's and then into a master's. So usually about 6 years to complete this. There are some 5-year options, and it can take as long as 8 if you are not in a career that's very defined, where you can go straight through your program. Occupational therapists. One of the words I used with physical therapists, number 7, was gross motor, large muscle groups functioning together. With occupational therapy, we might consider daily living skills and fine motor function instead. So daily living skills may be things like being able to brush your hair, brush your teeth. They might use adaptive equipment to help someone after a stroke or after a heart attack sort of regain some of the skills that they may have lost as a result of those ailments. They are able to work in schools. So sometimes they work with children with disabilities. They may work in special education classrooms. They may work in veterans hospitals, particularly with individuals who have had brain injuries. So occupational therapists may work for a lot of reasons. When I was in high school, I was a hockey player and I broke my finger like this. So my finger doesn't close. When I go to make a fist like that, it doesn't close correctly. So I went to hand therapy with an occupational therapist, and I got the skills back in my hands so that I could play hockey. In fact, when I was in therapy, they took my hockey stick and they were able to mold my cast to my stick so that I could still play, which was a really cool experience. So I actually worked in my occupational therapy clinic, and I encourage all of you, if you ever have the unfortunate experience through sports of being injured, to ask some of your providers if you can job shadow them or potentially interview them about what their best and worst days were on the job. It's a really great way for you to find out if that might be a good career fit for you or not. I think it's just as valuable to know what careers you don't want to do as it is to know which careers you do want to do, right? So it's never wasted time, even if being an occupational therapist or an athletic trainer isn't your first choice. Some of those are the first people you may interact with, and it's always a great option to ask these individuals for some advice. And then the last career I'll talk about today before concluding here is the pathologist assistant who looks for the presence or absence of disease on a variety of patients. So I just wanted to go through a couple more slides today. So here in the red, when we look at medical doctors, vets, pharmacists, physical therapists, and optometrists, the red boxes here show how an MCPHS student is able to accelerate their career and really eliminate some of these barriers from graduate school. So getting into graduate school can be even more difficult than getting into university. And many healthcare careers require either a doctorate or a master's degree. So why should you perhaps go to one of these accelerated programs? Well, perhaps because you will save time and money, and at an earlier age, you'll be working. So over the lifetime of your career, you'll have a larger earning capacity. Here in the gray are the traditional pathways that students are taking to get to some of these careers. So you'll see these pathways are longer, and many of them have wherever it says AT, that stands for admissions test, right? So the medical school admissions test, the pharmacy school admissions test, GRE is also a form of a test, and the OAT is another test. And international students, as you may know, many of you are much more talented than me in the way that you perhaps understand my presentation and also could understand Diego at the beginning of this presentation. And so you're bilingual speakers, and that's incredibly valuable. But as a result, here in the high school level, you'll already have to take a second test, the IELTS or the TOEFL exam, to prove your English proficiency. So taking another test in English to get into graduate school is quite cumbersome for many international students. So many of them will want to do one of these accelerated programs. Here in PharmD, you'll see our students have no reapplication process, no exams to take. They just go directly through. And they go through based on their English score that they had from high school, and that's it. So many of you are perhaps in grade 11 or grade 10 or going into grade 12, just started grade 12, and this can be very attractive. Also including the MCAT not being required for the MD and DVM programs. I can share this with any of you if you'd like to look more into this. I'm happy to assist you. This looks a little bit more in depth with our pharmacy program. Our PharmD program also has a dual degree option, and where students can get their PharmD and their MBA at the same time. So if you wanted to open your own pharmacy and work in that capacity, that's also very interesting for students. These are our upcoming application deadlines. If you are a recently graduated high school student, we are doing classes virtually in the fall, so you could potentially start some university classes this fall with us. It's getting a bit late for that, but it's possible. But most of you are potentially in grade 12 now, or perhaps in grade 10 and 11 preparing, and these are our early applications coming up here. Diego and I both work a lot with Common App, but MCPHS has a no-fee application as well on our own website, so you can work with Diego and I on this. We would require your official high school transcript. And again, the SATs are not required here. However, you do need to submit a TOEFL or IELTS, particularly if English is not your native language. And then we require an essay, which we want to know which career are you interested in, why. Perhaps you'll write your essay that you're interested in nuclear medicine technology because you came to a presentation on August 17th, a webinar that EFG and MCPHS hosted, I hope, maybe. And then also one recommendation letter, and this can be from a math or science teacher, or that could be from a healthcare provider, perhaps, that you've been able to shadow or interview during your exploration into healthcare careers. Here are more ways to find out information about healthcare careers and also about MCPHS University, again located in Boston, Massachusetts, across the street from Harvard's medical school in the Longwood medical area. My email is here. There are daily tours offered virtually live. So you can actually go on to that website there, visit-us, and you can sign up, and a student will actually give you a tour virtually of campus, and you can interact and ask perhaps more questions than you asked today. Let us know if you have any questions. And then to the right, we're all over social media. I think that YouTube is probably the best way to see where our students live, what our residence halls look like, what our dining hall looks like, what Boston looks like. It's a great city to be in. There are a lot of students here. There are over 46 universities in Boston. There are more universities in Boston than any other city in the United States. Again, making it a really beautiful place for you to hopefully explore this next decision in your process. I would love to hear from each of you. So if you could send me an email and just let me know you were here today, I would love to stay in touch with you. And Diego, I know you would as well. So thank you all so much for coming today, and I'll take any final questions we have.
Great, thank you very much, Christina. Basically, I have many students just texting me on WhatsApp and privately on the chat box saying that they understood everything you said.
Okay.
Like, you explained very good, but even though, guys, you don't have a question, please share, I don't know, all those careers that teacher Christina said. Which of those careers do you want to, I don't know, are you interested to become?
I think I'm most interested in cardiology. In being cardiologist.
Yeah, Mariana, that's a great career to go into. I think one of the really cool things I got to do when I was a staff member here, our ultrasound clinics actually on Fridays from 9 a.m. to noon are open for our students to practice scanning. And so I went down there and I had a full EKG done of my own heart. So I think that's great if you're, I think coming to a school, I know a lot of you maybe have heard of our famous neighbors, MCPHS is near Harvard and Northeastern and Boston University. These are really big research schools. These are great choices if that's the type of environment that you want. But at a small school like MCPHS, if you're interested in something like cardiology, that would be great. You could come and get your EKG done while you're studying anatomy, and you could see all the ventricles. You can see sort of your own blood flow. I think that real life learning at a small school that's really specific in health sciences really excites our students. So hopefully, Mariana, we'll see an application from you, maybe into pre-med to go into cardiology in the long run, or perhaps into ultrasound.
Yeah, who knows, maybe.
Mariana, which grade are you?
I'm on the 3rd grade.
Okay, so está no 3º ano?
Sim.
Okay, so grade 12. So she finishing.
Well, I'll get back to you. Please email us. I'd love to send you our application and help you through that process. I can see Giovanna looking at the DVM option. Veterinarian actually is statistically the hardest doctorate program to get in the United States.
Really?
Yes, just
Is
because
it?
it's lower acceptance rates than medical school, only because there's not as many schools. So medical schools, there's you know, a few dozen. So there's quite a bit more in the options. Veterinarian, not so much. So this early assurance for the doctor in veterinarian medicine is very attractive. The other career in animal science that I didn't mention is the veterinarian technicians programs. Our school does not offer one, but if you are interested, you can talk to Diego, and I can always, Diego, I know of some universities here that offer that, so I can help you with it.
What is the difference between then, teacher Christina? What is the difference?
Well, one is definitely salary. So veterinarian technicians may make anywhere between 35 and 50,000 US dollars per year, where veterinarians are going to make upwards of 80 to 100,000 per year. So it's quite a bit more for veterinarians. Veterinarians would be able to diagnose and prescribe and treat and do surgery and really have the full scope of care. of animals, where a veterinarian technician is going to work in the capacity of the nurse. So they may do more of the carrying the orders that the veterinarian gives. So they may push the medications, they may treat the patient, but they don't develop their own treatment plan. They sort of are carrying out the orders of the veterinarian.
Okay.
Teacher,
Yes.
sorry, you can repeat about public health, please.
About public health?
Yes, yes.
Yeah, that's a great question. So public health has a lot of choice. I think that it's a very hot button right now just because of the global pandemic, right? So public health is a big umbrella that covers lots of different careers. So here in the United States, for example, I live in Massachusetts. There are public health providers that work in the city of Boston, and they might work for the city. So they might go into nursing homes and evaluate their cleanliness. They might evaluate the treatment. There was one nursing home here in Massachusetts that had a large outbreak of COVID-19. So they did investigation there to see sort of how things spread quickly. At the national level, they may look at big outbreaks that happen, not just around COVID-19. Before all of this, we were looking at the flu. We were looking at how to get information out to patients. All of that is executed by public health providers. There are public health providers that just do research, so they might work in a laboratory. Well, public health is going to cover how does a large group of people focus on their health? How do we improve their health? And they might work with those big groups to sort of address some of those big public health questions.
Oh, thank you.
You're welcome.
That's great. Anyone else?
And Rodrigo, I'd be happy to send you some more information if you want to send me an email. And I encourage all of you to send me an email and tell me what program you're interested in. And I will send you some more information about your specific program. So in our website, I can show you the courses that you might take. I can show you what laboratory you might work in at the school. I can introduce you to a current student. There are many choices that we can help sort of eliminate any concerns you have when it comes to studying in Boston, okay?
He's very cool.
Yeah, it's very close.
And Christina, you guys from your university, MCPHS, you guys have a scholarship, and I think it's great to mention that for them, especially for them who are on grades 12, like Mariana, Giovanna, because they are almost finished, so we also can apply. If they want, they can apply for them.
You know, Diego, that's a great point. And so I just want to say here on this slide at the bottom, you can see 16,000 a year. And one of the things that we didn't talk about was, and I think this is a good slide to show you. So when a student comes into our 7-year pathway for optometry or our 6-year physical therapy or pharmacy pathway, we give them the scholarship of $16,000 per year. So that scholarship is something that you get first year, second year, third year, fourth year, fifth year, and sixth year, where many times if you go into these traditional pathways, you may get a scholarship for your first 4 years, the bachelor's program, but then you don't get a scholarship for the graduate portion, right? And if I had to make you all guess, do you think graduate school is more or less expensive than undergraduate? What do you think? What do you think, Mariana? Is it more or less expensive?
I'm sorry, could you repeat, please?
Do you think graduate school, the second half here, these optometry, pharmacy, and medical school, you think it's more expensive or less expensive than the bachelor's degree programs?
I would say more expensive, but I don't know.
It's definitely. That's great, Mariana. So you definitely want to have a scholarship secured to help you with graduate school if you can get one, right? So that also makes MCPHS a really popular choice for international students, okay?
Okay. Thank you.
Yeah, and then if we do the math, for the 6 years of scholarship, on the total, you guys will have almost $100,000 scholarship, which is amazing. Yeah, so
Absolutely.
if anyone is interested to apply for the pre-med programs or for the any pathway program, please contact me, and then we can arrange a call with teacher Christina. But just very, very quick, before we finish, has anyone got any another career that teacher Christina's mentioned that you guys are interested in?
I think I would go for dermatologist, as a dermatologist.
Excellent. That's a very interesting career. I think one other thing we didn't talk about, I talked about maybe what type of patients you want to have, how long you want to go to school. But with dermatology, what's nice is that if you think about how much you want to work or how long a day you want to have when you're working. Some of you are super excited to be brain surgeons, and it doesn't bother you to think about working for 15, 20 straight hours. Dermatology is very nice in the way that it is not so long, perhaps. There are PA dermatologists, those physician assistants I talked about. Dermatology is also, in terms of the salary, quite high out of all the residency options. So very good choice there. And they actually usually work a shorter day. So not very many skin emergencies. There are some, maybe if you specialize in burns, but for the most part, it can be a little bit more of a relaxing schedule.
It's more clinical, isn't it?
Yeah, a little bit more clinical based than like an ER doctor who might be on call for, a couple days. So quite different.
This flexibility sounds really, really nice to me, like a nice schedule.
Yeah, it is a very good schedule. So good foresight there on that career. And if you want to fill out a pre-med application, that'll be the first start. And I'd be happy, Diego and I would be happy to set up a call and get that going with you, okay?
Okay, thank you.
Of course.
Dora, which grade are you?
I'm on here in Brazil the first, so I guess it's the 10th one, right?
Yeah. All right. Anyone else want to share? What do you guys want to? Are you guys interested in to become? No. Okay. They just said they enjoy a lot. I'm getting a lot of message on my WhatsApp here. They enjoy it a lot, and they understood everything you said, which is great. So yes, guys. So thank you very much. Thank you very much, Teacher Christina. I really appreciate. I think it was great to have you here and to talk about all those areas from health and science and open the mind from the students. That's the purpose of mock class from my way, to help them to find their career way, their career field. So thank you very much for joining us.
Of course. Thank you so much for having me today, Diego. Be well, stay happy and safe to all of you from Boston, Massachusetts, and hopefully time will change things, and we'll all be a healthier, safer world in the future, and I'll be in Brazil again, able to see some of you. And until then, Diego and I are happy to have these virtual calls with all of you, and I'm looking forward to that very much. So thank you all for your time today too.